What if the very health checkups we thought would save our lives might actually be putting them at risk? That question may sound shocking, even unsettling, but it's one every American over 65 should be asking. In today's healthcare culture, where more tests are often equated with better care, seniors are often pushed into a cycle of screenings and scans that promise peace of mind. But the truth is far more complex. After age 70, your body doesn't respond the same way it did in your 40s or 50s. And not every test that once helped can still help now. In fact, some of the most commonly recommended checkups may trigger a chain reaction of stress, unnecessary procedures, and long-term harm, all in the name of prevention. This video takes a bold, honest look at 5 medical tests seniors should seriously reconsider. Backed by expert insights, real-life stories, and a deep respect for aging wisely, this isn't about fear. It's about power, the power to choose what truly serves your well-being. So if you're someone who values health, independence, and clarity over unnecessary worry, stay with us. What you learn today could change how you protect your health tomorrow. 1. The colonoscopy trap. For decades, colonoscopy has been hailed as one of the most effective screening tools in modern medicine, a hero in the fight against colon cancer. And rightly so, for those in their 50s and 60s, especially with a family history or troubling symptoms, it has saved countless lives. But once you enter your 70s, the story shifts dramatically. What was once life-saving may now be a source of more risk than reward. Let's start with the procedure itself. Colonoscopy is not a casual exam. It requires full bowel preparation, which involves drinking large amounts of harsh laxatives that completely flush your digestive tract. For older adults, this alone can be dangerous. Dehydration, low sodium levels, and sudden drops in blood pressure can increase the risk of dizziness and falls, one of the leading causes of serious injury among seniors. Then comes sedation. Many older bodies metabolize anesthesia more slowly, meaning confusion, grogginess, and disorientation can linger far longer than expected. These effects don't just ruin your day, they can seriously affect your cognitive function and even your mobility, especially if you live alone or are already managing other health conditions. And what happens if the colonoscopy finds a small polyp? In most cases, these are benign, slow-growing, and may take 10 to 15 years to become dangerous, if ever. But once discovered, the fear kicks in. Many seniors are led down a path of follow-up procedures, repeat colonoscopies, or even partial bowel resections. All this for something that, statistically speaking, might never have impacted their life at all. Here's where we need to stop and reassess. For someone in their mid-70s or beyond, especially those with a clean colonoscopy history, the likelihood of that polyp turning cancerous within their remaining lifespan is extremely low. Yet the physical and emotional toll of follow-up treatments can be very real and often devastating. I recently heard about a man named George, an 82-year-old in good health, active and mentally sharp. He underwent a routine colonoscopy, just to be sure. The result? No cancer. But the prep left him severely dehydrated. That night, still groggy from sedation, he fell in the bathroom and fractured his hip. One preventive test led to months of rehab, lost independence, and a deep emotional toll. It's time we redefine what prevention looks like after 70. Today, there are safer, non-invasive alternatives like fecal immunochemical tests, FET, or stool DNA tests. These options are much gentler on the body and offer valuable insights without the risks associated with full colonoscopy. Choosing not to have a colonoscopy after 70 isn't negligence, it's wisdom. It's recognizing that aging requires a different standard of care, one that respects your body's limits and prioritizes quality of life. Remember, longevity isn't just about living longer, it's about living well. 2. The annual full body scan mistake. Imagine being told that with just one scan, you could uncover every hidden threat inside your body before it becomes a real problem. Sounds like a dream, doesn't it? Especially after 70, when health feels more fragile and the desire for certainty is stronger than ever. That's exactly why full-body CT or MRI scans are becoming so tempting for older adults. But here's the uncomfortable truth. These tests often create more problems than they solve. Full-body scans are powerful imaging tools, But that's not always a good thing. They detect everything, including benign abnormalities that would never cause symptoms, never shorten your life, and never need treatment. These are called incidental findings, and they're incredibly common. A small cyst on the liver, a shadow near the lung, a nodule on the kidney. These harmless anomalies can trigger a wave of worry, follow-up tests, and even unnecessary surgeries. The danger becomes real when we consider how seniors' bodies respond to those follow-ups. A biopsy that's relatively low risk at age 45 can lead to infection, internal bleeding, or weeks of painful recovery in someone over 70. Lying still for long scans can strain joints, and anesthesia becomes far riskier. Emotionally, it creates anxiety over things that may never have mattered, robbing seniors of the peace of mind they were hoping to buy. Let's look at a real-life example. Betty, a vibrant 78-year-old who exercised daily and felt great, decided to get a discounted full-body scan at a local health fair. The scan found a small lesion on her kidney. Too small to worry about, according to one doctor. But the word lesion terrified her. Within weeks, she was in surgery. What followed was a long, complicated recovery with fatigue, complications, and a life that never quite returned to normal, all for something that might never have needed attention. It's a classic case of overdiagnosis, where detecting a minor issue leads to major intervention with little to no benefit. Worse yet, these scans are rarely covered by Medicare or private insurance unless they're ordered for a specific concern. Many seniors pay out of pocket, believing they're investing in prevention when they're actually stepping into a system that may never stop testing or intervening. This doesn't mean all imaging is bad. If you have symptoms, persistent pain, unexplained weight loss, or something that clearly needs evaluation, then by all means, scan with purpose. But scanning without cause, out of curiosity or fear, can backfire in ways that cost your energy, independence, and quality of life. At this stage of life, it's time to redefine what smart prevention looks like. It means trusting how you feel, valuing your current well-being, and not letting a machine dictate your peace of mind. The healthiest choice isn't always the most high-tech. It's the one that protects your time, your strength, and your joy. 3. The overuse of cardiac stress tests. There's something deeply reassuring about checking your heart. It's the organ we most associate with life itself, the pulse of our very being. So when a doctor recommends a treadmill stress test just to be safe, many seniors understandably say yes. But after the age of 70, this once routine exam might be doing more harm than good, especially when you feel fine and show no signs of heart trouble. Here's why. The traditional cardiac stress test, whether it's walking on a treadmill or receiving a chemical agent to simulate exercise, aims to evaluate how well your heart functions under pressure. But the test was originally developed for middle-aged patients, not older adults with naturally changing bodies. Over time, aging causes stiffening of arteries, mild fluctuations in heart rhythm, and slower recovery post-exertion. These normal changes can trigger false positives, results that suggest heart disease when none exists. That's where the real trouble begins. A false alarm often leads to a cascade of follow-up tests, echocardiograms, angiograms, catheterizations, and sometimes even stent placements or bypass surgeries. These are not harmless procedures. For seniors, the risks include internal bleeding, kidney damage from contrast dye, stroke, and extended hospital stays. And even when no major issue is found, just undergoing the process can leave an older adult fatigued, frightened, and worse off than before. Consider George, a 74-year-old who walked every morning and never had any chest pain or fatigue. During a routine checkup, his doctor suggested a stress test, just in case. The results were borderline, and that led to an angiogram. A small, non-blocking plaque was found, but a stent was inserted anyway. Within days, George developed an infection at the catheter site and ended up in the ICU. What started as a simple precaution spiraled into months of rehabilitation and anxiety. It's important to understand, no test is neutral. Every medical procedure carries risk, physical, emotional, and financial. And for people in their 70s or 80s, recovery becomes slower, complications more likely, and outcomes less predictable. Today, many respected cardiologists and geriatric experts argue against routine cardiac stress testing in seniors who have no symptoms. If you're not experiencing chest pressure, shortness of breath during light activity, or unexplained fatigue, the benefit of testing is minimal. In fact, studies show these screenings do not significantly lower the risk of heart attacks or death in asymptomatic older adults. Instead, focus on functional heart health, walking daily, eating well, managing blood pressure naturally, and staying socially engaged. These lifestyle practices are not only safer, they're proven to protect your heart long-term without the risks tied to unnecessary procedures. Ultimately, being proactive about your health doesn't mean testing everything. It means knowing when not to test. And at this stage of life, wisdom often lies in choosing rest over rush, simplicity over complexity, and peace of mind over medical overkill. 4. The pitfalls of repeated colonoscopies. After 70, colorectal cancer is one of the most feared diseases among older adults, largely because it often develops silently, without obvious symptoms until it's advanced. For that reason, colonoscopies have long been viewed as a powerful preventive tool. But here's what many people over 70 aren't told. Once you've had 1 or 2 clean screenings, repeating the test every few years may not be necessary and could even be dangerous. Let's be clear, colonoscopies have saved lives, but that doesn't mean more is always better. After a certain point, especially beyond age 75, the potential benefits begin to decline, while the risks sharply increase. Why? First, the physical demands of the procedure are no small matter. The bowel prep alone, drinking liters of strong laxatives, is extremely dehydrating. For seniors, that can throw off electrolyte balance, lower blood pressure, and cause fatigue, dizziness, or even dangerous falls during nighttime bathroom trips. Then there's the issue of sedation. Older adults process anesthesia differently. The liver slows down, the brain becomes more sensitive. Post-operative confusion, memory fog, and even delirium are common side effects, sometimes lasting weeks. For some, these effects can trigger a cascade of physical setbacks, especially when living alone or managing other conditions like diabetes or cardiovascular disease. But perhaps the most overlooked danger is something called the time horizon of benefit. Colonoscopies are designed to catch slow-growing polyps that may turn cancerous in 10 to 15 years. But if you're already in your late 70s or 80s and you've had prior clean tests, it's likely those polyps would never become life-threatening in your remaining years. Let's consider Eileen, a 78-year-old retired teacher. She had clean colonoscopies at 60 and 68. At 78, her doctor recommended another just to be safe. She agreed, but during the procedure, her colon was accidentally perforated, a rare but very serious complication. Eileen required emergency surgery and was hospitalized for nearly a month. Though she survived, she never regained the same mobility or energy. Her independence declined, and worst of all, no cancer was found. Eileen's story isn't unusual. According to recommendations from the U.S. Preventive Services Task Force and other leading medical groups, routine colonoscopies are generally not recommended after age 75 unless you are showing symptoms like rectal bleeding, persistent abdominal pain, or unexplained weight loss. In those cases, further evaluation is certainly warranted. But in the absence of such signs, repeating the test just in case may bring more harm than peace of mind. Thankfully, there are non-invasive alternatives that are better suited for aging bodies, such as EFIT, fecal immunochemical test, or Cologuard stool DNA tests. They offer real value without the sedation, prep, or risks of hospitalization. The bottom line? Don't let fear override logic. At this stage of life, health decisions should be based on evidence, not habit, and certainly not pressure. You've earned the right to prioritize living well over testing endlessly. 5. The overuse of routine cardiac stress testing. For many older adults, heart disease feels like the ultimate hidden threat, something that could strike without warning. You hear stories of seniors collapsing after feeling just fine the day before. Understandably, that fear drives people to agree to tests like the cardiac stress test, hoping to catch a problem early. But here's the hard truth. If you're over 70 and symptom-free, this test may do more harm than good. A standard stress test involves either walking on a treadmill while being monitored or receiving a drug that mimics the effects of exercise. The idea is to push the heart and watch how it responds. That sounds logical on paper, but the reality for seniors is far more complicated. The aging cardiovascular system naturally experiences changes: stiffer arteries, slower heart rate recovery, slight changes in electrical signals. These aren't always signs of disease, but they often trigger false positives on stress tests. False positives can set off an avalanche of follow-up procedures. Doctors may order nuclear imaging, catheterizations, or even place stents in arteries that weren't actually threatening your health. These procedures, while common, aren't risk-free, especially in older adults. The contrast dye used in imaging can cause kidney damage. Catheterizations can result in bleeding, stroke, or infection. And hospital stays? They often lead to deconditioning, disorientation, and loss of independence. Let's take the case of Harold, a 76-year-old grandfather who had no symptoms, no chest pain, no fatigue, no shortness of breath. During a routine checkup, his doctor recommended a stress test just to be safe. The results came back slightly abnormal. That led to an angiogram, which showed mild plaque buildup, not unusual for someone his age, but a stent was inserted anyway. Days later, Harold developed internal bleeding from blood thinners and was hospitalized for weeks. His recovery was long and difficult, and the whole ordeal stemmed from a test he didn't need. You might be wondering, what do the experts say? Many leading cardiology associations now recommend against routine stress tests for older adults without symptoms. They emphasize that these tests do not reduce heart attacks or extend life for people who feel well. The real benefits of stress testing come when there are symptoms to evaluate, like unexplained shortness of breath, chest discomfort during mild exertion, or palpitations. So what's the better approach? It's called symptom-guided care. If something changes, if you feel pressure in your chest when walking upstairs or experience new fatigue, it's absolutely appropriate to investigate. But if you're active, sleeping well, and living comfortably, your body's already giving you better feedback than a machine ever could. At this stage in life, the goal isn't just to live longer, it's to live better. That means avoiding the medical conveyor belt of unnecessary procedures. It means asking, will this test change how I feel or function? And most importantly, it means trusting that sometimes doing less is the wisest kind of care. Aging is not a problem to be fixed. It's a journey to be honored. And as you move through your 70s and beyond, your approach to healthcare should evolve with you. More tests don't always mean better care. In fact, as we've seen, they can sometimes lead to anxiety, unnecessary procedures, and even serious complications that could rob you of the very independence and joy you've worked so hard to maintain. The true power lies in discernment, in knowing when to say yes and when to say no. You're not neglecting your health by refusing unnecessary checkups. You're protecting your energy, your clarity, and your dignity. At this stage of life, that's not just wise, it's essential. Talk with your doctor. Ask thoughtful questions. Don't be afraid to challenge the status quo. If a test won't change how you feel, function, or live, maybe it's not worth doing. You've earned the right to live life on your terms, not trapped in a cycle of overtesting, but free to focus on what really matters: connection, vitality, peace of mind. If this video gave you a fresh perspective, leave a comment below and share what resonated with you. And if you found it helpful, don't forget to like, subscribe, and share it with someone you care about. Your support helps us keep creating content that empowers older adults to live smarter, stronger, and with more confidence. Here's to aging boldly and wisely.